Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita. I can't hear you.
I'm still adjusting to the year change.
Oh, okay.
And you are?
Oh, I'm Jean Marie.
Hi, Jean Marie. I hope you adjust well. I'm Ron.
Well, before we get started on the new episode, I've got a couple of announcements to make.
Oh, no.
We would like to thank all of our listeners, guests, and the judges for nominating us for a second year in a row at the National Health Information Awards. In 2025, the National Health Information Awards celebrated their 32nd anniversary, 32 years, of honoring high-quality consumer health information. And we are bronze winners once again in the digital health media category, which honors the best digital health resources developed for consumers and health professionals. And besides that, we also won a silver award for the digital media, from DANDA, highlighting the significance of design and aesthetics in healthcare. DANDA Awards honors outstanding contributions in both digital and physical or print-based materials during each season of the semi-annual program. So we closed out 2025 with 2 awards, and we are extremely grateful to all of our guests and listening audience. And I'd like to take the time to thank my team for their part in providing an excellent show. That would be Sean in recording, Jack in editing,
Dominic in all things
all
digital,
things,
audio,
all things that
electronics.
we fail on. Mary on transcriptions.
Yep.
Ron and Jean in
Hosting.
co-hosting. It's been one heck of a year. So
It has been.
we got through it. Now today we're going to launch a brand new PodcastDX mini-series. We're really excited about it. It's called Medicine in Transition. This series is about how healthcare is changing, sometimes quickly, sometimes painfully slowly, and what these changes mean for patients, families, caregivers, and clinicians. And we're starting with the big picture. Why does healthcare look so different today than it did just 10 years ago?
It's all the wrinkles. I think a lot of people feel this shift, even if they can't quite explain what it is. Healthcare provider visits may feel shorter. There's a significant amount of technology that's now included in healthcare providing, if you just picture, what a hospital room looks like with all of the technology that's involved in patient care there. It's incredible. There are more portals or digital ways to correspond with your healthcare provider and receive feedback from, in your test results and all of that. There's a lot more forms to fill out, and many of these you can fill out in advance of your appointment and do it online. There are more specialties and specialists, and definitely a lot more information available online for both clinicians and for patients and caregivers.
Right. And ironically, at the same time, people feel less seen and more processed. Maybe faster, but it's also more fragmented. It's not the same feeling to
That's
the doctor before.
that's for sure.
It's like herding cattle. Get them in, get them out.
Yeah. And what Jean was talking about with the more portals, I think that is absolutely
Okay.
a horrible thing for elderly.
Okay.
They don't understand it.
That's not true. Not everyone is averse to digital things.
But I do agree with Lita. for
You think
older people, technology isn't as
easy?
simple.
Yes.
But
And
I know that healthcare providers who are serving a population that doesn't readily use digital things like, for example, like my great aunt, she still receives calls at home.
No.
No,
No.
they stopped making calls to home.
Correct.
so the point is, even when you call the doctor's office or anywhere for that matter, they say, well, we'll check the portal, check on my chart, do this. Everything's electronic. And it's nice that that information is available, but that should not be the
The only way.
first
Or
go.
to make an appointment, make it online. No, not everybody could do. I'm just saying that
Yeah.
Okay.
you can't have only electronic. What happens if there's a power outage?
But I do like the ability to make an
Yes,
appointment.
it's-
I
see their
agree.
Yes.
schedule.
Having that ability.
An alternate.
Yeah. And you know what? I mean, this is going a little bit off topic.
No,
but
not,
it's the same
not really.
thing. I was just at the grocery store.
Wait a
And
minute. That is off topic.
It is off topic.
Okay.
But the point I'm making is they had sales, but you had to use digital coupons.
Oh my God. Auntie's worst experience. She gave up going to that grocery store because of that.
And that's exactly my point. I mean, it's nice that it's there. And for younger people who are more adept at using, more patient with that, it works great. But, it's not like, we have one foot in the grave, but when you're older, it's not as simple. And the fact of the matter is you won't get your discounts if you don't use the electronic coupons.
Right.
But, getting back to the topic at hand, again, it's nice that the information is available online so you can get it 24/7. But when that's the go-to means or the go-to preferred way to do it, it just doesn't work for everybody.
Right. Well, 10 years ago, healthcare was already complicated, but today it feels like you were saying industrial.
Mm,
And yet, paradoxically, there's also more emphasis on patient voice, shared decision making, and quality of life,
okay.
but very short spurts of it, I think. So we're living in this tension. There's more tools, there's more data, there's more innovation, and more burnout, more confusion, and more frustration.
I totally agree. And one of the biggest shifts is that medicine used to be built around acute illness. You get sick, you get treated, hopefully you get better. But now, most people are living with chronic conditions, diabetes, autoimmune disease, heart disease, neurodegenerative conditions, long COVID.
Right. The system wasn't designed for that. It was designed for emergencies, surgeries, infections, not for decades-long management. Maybe that's why they're changing.
Mhm.
So patients end up coordinating their own care, tracking their symptoms, advocating for themselves, and filling the gaps.
And ironically, I think I'm overusing that word, it gets exhausting, especially when you're already sick.
Right, right. Technology is everywhere now. Like Gene was saying, electronic medical records, telehealth. How about the wearables, AI tools, patient portals?
I know the watches and everything. I mean, as amazing as they are, it's I don't know. Some of it, like I said, some of it. Look at that.
Nice, Ron.
Wow. All right. So some of it is incredible, like we were just saying. We can actually monitor our own heart rhythms from a watch.
Mhm.
Okay, that's exactly what I was talking about. We can consult specialists across the country, which is great. And, we can also catch diseases earlier.
And that doesn't mean catch them like don't wear a mask. It means find out that you've got one
Right.
earlier so you can treat it earlier. The wording was. Anyway, technology also changed the feel of healthcare. Clinicians spend more time looking at screens
Yep.
like
hmm
tablets, phones, instead of the people. As a matter of fact, who did that? There was a TV show where they actually were kind of making fun of that, and the person never looked up from the
Yeah,
screen.
I can believe that.
They should have looked up and found the janitor there. Appointments are dictated by templates, checkboxes, and billing codes. Patients feel like data points sometimes, and yet technology isn't the enemy. The problem is when technology replaces the relationship instead of supporting it.
100% right. Today, patients are far more informed than they used to be. They use Google, they use other sources of checking information. They join online communities. They read studies because they're a lot more easily accessible.
Right.
Um,
And they listen to or participate in podcasts like ours, which could be empowering or terrifying.
right. I do want to jump back a little bit though to like Google and things like
Yeah.
that. It can be nice because that information is there, but there is so much information, it can get overwhelming, and it is best to talk with the doctor himself or herself to find out. Otherwise, coining a term, going down rabbit holes.
Right. And let me throw something in there. I was talking to somebody the other day, and the question was, I wonder if I have parasites. And I'm like, I kind of doubt it. What makes you say that? And there was an ad online. You know how they got the ads for medicines and things? There was an ad online saying, if you have this, this, and this, you probably have parasites. I'm like, okay. Too bad they didn't point out also, but if you live in the United States and you don't swim in a mucky river and you don't eat raw meat, then chances are all of those symptoms are going to be from something else.
Right.
But they're getting like just enough information to be dangerous, I think, what they say.
Right.
So patients are expected to understand complex medical information, insurance roles, medication risks, and treatment options, often with little guidance. Shared decision making is the goal, but it only works when people are supported, not overwhelmed.
Right. Another big shift right now is that medicine is starting to talk more openly about quality of life.
Right. Not just how long can we keep you alive, but how do you want to live?
Right. And that's huge, especially with chronic illnesses, disability, aging, dementia, cancer, and, well, end of care life. We're finally starting to ask questions like, or doctors are,
Yeah, right. We're not asking it.
yeah, the doctors are finally asking questions like, what is it that matters to you? What is it that you're willing to tolerate? What looks like a good day to you? How, more about you.
Right. And that conversation barely existed in mainstream medicine 10 years ago.
Right. Let's be honest, though. Some parts of the system are cracking, though.
Well, burnout is everywhere. Clinicians are overwhelmed. Patients feel unheard. Care is fragmented. And marginalized communities still experience worse outcomes. So technology doesn't automatically equal equity.
Correct.
But like we said at the beginning, medicine is in transition, but I guess we should say not evenly.
Right. Well, let's flip the script a little bit and let's talk about what is improving.
Okay. Palliative care is given earlier in disease, and that is supportive care. Better pain management models are now in effect, where before they would just throw pills at you.
Right.
Trauma-informed care is part of our healthcare system. And there are interdisciplinary teams, which are absolutely wonderful. I love those.
Right. There's also rehabilitation, recreational therapy. You and I know
Well enough about that.
exactly. And the holistic approaches are finally being recognized as being essential and not optional.
Well, mental health is also part of the conversation now. Patient voices matter more, and we're starting to value the outcomes beyond lab numbers.
And I think that's why you were saying earlier that we wanted to do medicine in transition as a series and not just one episode all encompassing.
Right, because we're gonna break it down into individual segments. No single advancement, drug, or technology tells the full story.
So medicine is changing culturally, ethically, changing technologically, and also emotionally.
And patients and their families are living inside that change every day.
Well, if there's one takeaway today, it's this. Hopefully, medicine isn't broken, but evolving, and that there are some painful humps to get over while it's evolving.
Right. And transitions could be uncomfortable, but they're also where growth happens.
Oh. Healthcare doesn't just need better tools, it needs better listening, it needs better balance, it needs better alignment with what it means to be human.
And that's what this series is about. So thank you for joining us for the first episode of Medicine in Transition. In the next 3 episodes, we're going to zoom in. We'll talk about AI in medicine, what it can do and what it shouldn't do. We'll talk about quality of life becoming a legitimate outcome. And we're going to talk about dementia care shifting from control to connection. This first episode was just the foundation, and we hope we see you next week.
As always, we'll have links and resources from today's show on our website. This podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. Never disregard professional medical advice or delay in seeking it because of something you've heard in this podcast.
Till next week.